We are talking about everything you need to know to keep you and your family healthy this fall. Health officials are warning about a whole lot of things. They're saying one thing in particular, whooping cough. Cases are accelerating, many among school-aged children. According to the CDC, there have been about 4 times as many cases this year compared to last year. That's a big uptick. Wow. There's also an unusual increase in what's commonly referred to as walking pneumonia. In young kids in particular, we're talking about ages 2 to 4. CBS News Chief Medical Correspondent Dr. Jon LaPook joins us now. Dr. LaPook, how are you?
I'm fine.
Let's talk whooping cough off the top here. Why is it dangerous and why a 4x increase?
Yeah, it's dangerous because, the infants and the babies have very small airways, right? So the reason why it's called whooping cough is, it's cough, 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 and then they gasp for air. That's the whoop, all right? For you, as an adult, when you get it, you may be sick, but you're probably going to be okay in terms of moving air in and out of your body. With the infants especially, the airways are so small that they can really have trouble breathing at all. Yeah. So what's going on is that there's an effective vaccine, but the vaccine for whooping cough, it's pertussis. You can't get it as a baby until you're 2 months. So until then, you're really relying on the adults being immunized, and this vaccine wears off over time. You're supposed to get another pertussis shot every 10 years. It's part of something called the Tdap, tetanus, diphtheria, and pertussis. But you know what the percentage of adults 18 and over who are actually up to date?
I'm scared to know.
44%.
I was going to say 5%.
Yeah. So when you were pregnant,
yep.
I suspect that you went to the grandparents-to-be and said, hey, do you have all your vaccines? At least that's what the OBs always tell the
No, we did.
do.
They said that they did, and I believe them.
Okay.
So you got to trust.
I believe.
All's well. Your kids are older now.
But what should people do, especially if they have younger kids? Is there an age that parents should be concerned if they see those symptoms of whooping cough? What should they do?
I think any age, if you're having trouble breathing, you're having trouble, and instinct, really, a mother's instinct, a father's instinct, a parent's caretaker instinct is really important. There's going to be no formula, but if you see that, certainly if there's any struggle breathing, getting air in, you definitely contact, a health professional.
Let's talk about walking pneumonia. You saw me avoid the medical term here, mycoplasma.
Mycoplasma.
Yeah, what is that?
Mycoplasma is a bacteria, and it's called atypical pneumonia. It's a kind of atypical pneumonia. It's called the walking pneumonia. It's not a medical term because people generally they can have no symptoms, mild symptoms, or you can have severe symptoms. So the walking pneumonia is you're sick, but you're still able to go around. But it's it can be serious. Again, if you have airway inflammation and trouble breathing, then it can be a real problem. And I spoke to the CDC. They got, really shout out to the CDC. I asked them questions. They get back to me right away. I said, why is it increasing? What's going on? And they said, it's not really known. It's probably multifactorial, but a couple of good reasons are, number one, post-pandemic rebound. So during the pandemic, we were kind of locked down. We weren't exposed to the normal bugs that we normally are. Think about it. All the time, we're getting these mini boosters of pathogens, of bugs. And so now, afterwards, they don't have the same kind of immunity. Also, something I hadn't thought of, but I should have, which is that there are more sophisticated testing now. These PCR tests. So you do the sputum, and then they have a panel for a bunch of different things that cause pneumonia. And I have to say that last week in my very practice, it was an adult person, had an illness, looked like I was hearing what sounded like pneumonia, got a sputum thing, and it was mycoplasma.
It was detected.
It was
wow.
mycoplasma.
Technological advances
It's treatable by antibiotics.
due to COVID. Thank you so much, Dr. LaPook. Love having you.
Good to see you.